Now the mechanical ventilation. Whenever patient is having the respiratory failure, severe respiratory distress, and not maintaining the target saturation with other oxygen delivery devices, then we have to use the mechanical ventilation. It works by applying the positive pressure breeze. It can be delivered in the different modes: volume limited assist control ventilation, pressure limited assist control ventilation, synchronized intermittent mandatory ventilation with the pressure support ventilation. In pediatric patient, we prefer the patient triggered ventilatory mode as SIMV, AC or PSV because less barotrauma and shorter duration of ventilation with these modes. So in the video you can see there are ventilator in which the pediatric, neonatal and adult all setting we can do. So first, according to the weight, we have to set the neonatal mode or pediatric mode. Then we have to choose the mode of ventilation. Then we have to set the FiO2, then positive inspiratory pressure, then RR we have to set, then TI and TE according to TI and RR will be set. So we have to set all the initial ventilatory setting. So it will show in the graphs also, and all the settings will be also display over the screen inside, and we can change the mode. So here you can see this is CPAP and PSV mode. So again we have to, once we change the mode, again we have to set the all the ventilatory settings, and it will display over the screen. So this is the inspiratory limb which is connected to the humidifier, and this will go to the patient, and this white one is the expiratory limb. So initial ventilatory settings are tidal volume between 4 to 6 ml per kg, peak inspiratory pressure 12 to 16 centimeter of water, maximum up to 25, or in meconium aspiration syndrome we can go up to 28 also. But with more PIP, chances of pneumothorax also high, so we have to keep in mind. Positive end expiratory pressure between 5 to 6 centimeter of water. Maximum we can go up to 8 if the patient is having severe respiratory distress in preterm baby. Respiratory rate depends on the age of the patient. Example, in neonate 30 to 60 per minute. Inspiratory time 0.4 to 0.5 second. Expiratory time TE directly set according to the TI and RR, or we can alter by using the TI and RR respiratory rate. And FiO2, we have to set the lowest FiO2 to achieve the SpO2 between 90 to 95%. Trigger sensitivity, two types, flow and pressure trigger. Pressure trigger usually we have to set -2 centimeter of water, or we should avoid if there is a autopip is suspected.